Hey everyone, and welcome back to Prime Med. Today's video is all about ear infections. There are two main types of ear infections. There's the outer versus inner ear infection. An outer ear infection, also known as otitis externa or swimmer's ears, is when the ear canal right over here becomes inflamed, swollen, painful. Sometimes there's pus, and usually it's painful when you pull or push over here. That's a good sign it might be otitis externa. We treat that with antibiotic drops. Avoid water or moisture in the ear canal, keep it nice and dry, apply the drops, and you should be good to go. In contrast, otitis media, or an inner ear infection, is when the eardrum, the tympanic membrane, is inflamed, it's bulging out due to the inflammation and the fluid behind it. Typically speaking, it's an acute onset of pain. So sudden pain, for example, your kid is just screaming in pain all of a sudden, that might be a good sign that there might be ear infections. Just so you know, 5 out of 6 kids by the age 6 will have an ear infection, in contrast to an adult where just 20% of adults get ear infections. So a lot more common in kids. Briefly explain that is because the ear canal in kids is generally more straight, which allows for fluid accumulation, as opposed to adults where it's more angled, which allows more of a drainage to prevent ear infections. Either way, the way we treat an inner ear infection is not with drops. That is not sufficient. You need oral antibiotics, so by pill or by liquid. Generally speaking, for kids, we treat it with amoxicillin. If there's an allergy, we treat it with Ceftonir. As opposed to adults, we generally treat it with Augmentin. For both an outer and inner ear infection, Advil and Tylenol are great ways to alleviate the pain. And as always, stay well hydrated. I'll see you guys next time.